Hello everyone, this is question 23 of our 100 clinically oriented anatomy questions. So let's jump straight into it. The question says a 75-year-old man is transported to the emergency department with severe pain of his right hip and thigh. Radiographic examination reveals avascular necrosis of the femoral head. Which of the following conditions will most likely have occurred to produce avascular necrosis in this patient? Option A, dislocation of the hip with tearing of the ligament of the head of femur, intertrochanteric fracture of the femur, intracapsular femoral neck fracture, thrombosis of the obturator artery. Option A, dislocation of the hip with tearing of the ligament of the head of femur. So the artery that runs along the ligament of the head of femur is the obturator artery, and the obturator artery is the major arterial supply to the head and the neck of femur in infants. All right, it is in children that you have the obturator artery serving as the major arterial supply to the head and the neck of femur. So that is not the correct answer because the person we are examining is a 75-year-old man. So it will not dislocation of the hip with tearing of the ligament of the head of femur will not result into avascular necrosis in this patient. So option A is not part of our answer. Option B, intertrochanteric fracture of the femur. Intertrochanteric fracture of the femur will not affect the blood supply to the head and the neck of femur, although it's going to cause issues. That is, the muscles attached there are going to be affected, but avascular necrosis of the femoral head is not a direct consequence of the intertrochanteric fracture of the femur. Option C, intracapsular femoral neck fracture. Intracapsular femoral neck fracture is going to cause avascular necrosis of the femoral head because this is where you have the major blood supply to the femoral head and the neck. This is where you have them passing through. All right, the retinacular branches of the medial and the lateral circumflex femoral artery, which are the major blood supply to the femoral head, will be affected in an intracapsular fracture of the femoral neck, and that is what will result into avascular necrosis. All right, avascular necrosis basically means the death of a particular region due to blood loss or due to inadequate blood supply to that region. That is what it means. So intracapsular femoral neck will result into damage of the retinacular branches of the medial and the lateral circumflex femoral artery, and it will result into avascular necrosis of the femoral head. Thrombosis of the obturator artery. Like I mentioned, the obturator artery is not a major arterial supply to the head and the neck of femur in a 75-year-old man, which means thrombosis of the obturator artery will not directly cause avascular necrosis of the femoral head. And that is the solution to the question. I hope you understand and you enjoyed the video, and I'll see you in the next episode.